This is part one of video lecture for MDA, Chapter 43, Restorative and Aesthetic Dental Materials. Restorative and aesthetic dental materials most often used today are going to be amalgam, composite, glass ionomer, temporary restorative materials, tooth whitening products, gold, alloy, and ceramic castings. In order for a dental material to become available, it must not be poisonous or harmful. It must not be harmful or irritating to the tissues of the oral cavity. It must help protect the tooth and tissues of the oral cavity. It needs to resemble the natural dentition as closely as possible and also be aesthetically pleasing. It must be easily formed and placed in the mouth, and it must conform and function. There are certain properties that we want our dental materials to meet: mechanical, thermal changes, electrical properties, corrosive, solubility, and application properties. In some dental materials, we will hold some of these properties as more important than others, but we're hoping that our dental material of choice meets the majority of these properties. For mechanical, our materials must be able to withstand biting and chewing force in the posterior area of the mouth. They should be able to withstand any push or pull, reaction within the material that can cause distortion, being stress. They should be able to withstand strain, and these include the tensile, compressive, and then shear. Ductility and malleability. Ductility is the measure of capacity of a metal to be stretched or drawn out by pulling or tensile force without it fracturing. And then malleability is the measure of capacity a metal to be extended in all directions by compressive force, as in chewing. With thermal change, we're looking for the material to be able to withstand a change in temperature. So when we think about the oral cavity and as we're eating and drinking hot and cold things, we need our materials to be able to withstand those changes. Different materials expand and contract at different rates. The goal is for the tooth structure and the restorative material to have the same rate of contraction and expansion. An electrical current or galvanic action in the oral cavity can take place when there are two different or dissimilar metals present. Conditions that allow these electrical currents are the saliva containing salt being a good conductor, and then two metallical components of different composition acting as a battery. This sometimes will give the patient a tingling or a, we like to call them a zinger in the oral cavity. We talk about corrosion. Corrosion is the reaction that occurs within a metal when it's exposed to corrosive products like temperature, humidity, and saline. Certain foods contain metallic forms that cause corrosion of dental material. Most corrosion involves surface discoloration and can be removed easily when when we use polishing agents. So if you look at a older amalgam filling or silver filling, sometimes you can tell that it's lost its shine and kind of goes into a duller, darker color. That is what we call corrosion. Solubility is the degree to which a substance will dissolve in a given amount of another substance. A material that dissolves easily in the oral environment is of limited use because it can be washed away. For a dental material to have a specific mechanical properties, steps must occur in application of the dental material, including flow, adhesion, retention, and then curing. Direct restorative materials are applied to a tooth or teeth while the material is pliable and can be adapted, carved, and finished. Materials used in these types of restorative and aesthetic procedures are our amalgam, composite, glass ionomer, temporary restorative materials, and then our tooth whitening products. We're going to talk in this lecture about amalgam. Amalgam consists of several different types of metals, with silver being the predominant metal. Metals are in a powder form and then mixed with mercury to form a soft and pliable mixture. When placed into a prepared tooth, condensed and carved, and then allowed to harden, the mixture becomes a permanent amalgam restoration. Amalgam is safe, it's affordable and a durable material, and this is predominantly used to restore molars and premolars because of its aesthetics. Indications for using dental amalgam would include primary and permanent teeth. These are going to be used on our stress-bearing areas because amalgam is very strong and can withstand those forces. The amount to moderate sized cavities, the small to moderate sized cavities in the posterior teeth, severe destruction of tooth structure. We can also use amalgam as a foundation for cast metal, metal ceramic, and ceramic restorations. These are a good choice when a patient's commitment to personal oral hygiene is poor or lacking. If moisture control is problematic, so if we have an area that we just cannot keep isolated, amalgam is going to be a good restorative material to use. And then also, if cost is an overriding patient concern, amalgam is a cheaper option for our patients. Contradictions of reasons why we wouldn't use an amalgam is definitely aesthetics. So they're silver, they're shown as silver. So we don't want to use those in the anterior or front of the mouth. For patients who have a history or an allergy to mercury, when a large restoration is needed and the cost of other restorative materials or treatment options are not a significant factor in the treatment decision. So when we're looking at the composition of amalgam, we have mercury in a percentage of 43 to 54%, and then the alloy or the mixture of metals is 57 to 46%. The alloy powder is a combination of metals. So we can see silver, which is going to give the amalgam its strength. Tin allows for its workability and then also adds to the strength. Copper is used for strength, and then it's also going to help with the corrosion factor. So it's going to help resist that corrosion. And then zinc suppresses the oxidation. High copper alloys contain a higher percentage of copper than previous alloys. These are classified according to their particle shape. So we have spherical or round particles and then irregular, rough, lathe cut particles. So this is talking about the shape of the metals in the amalgam. With our spherical, they do allow us to polish the amalgam a little bit more of a sheen, and then with the irregular allow for the strength. Mercury to alloy ratios. The ratio must contain just enough mercury to make the mix workable without containing an excessive amount. So 1-to-1 mercury to alloy ratio is widely used. Non-mercury alloy called galloy, which is composed of gallium, indium, and tin, has been approved by the ADA. This is an alloy-based ingredient. It's soft, silver-hued metal that liquefies at 86 degrees Fahrenheit. It's sensitive to moisture, which can cause corrosion and then also expansion. There has been some controversy over mercury in the alloy, being that it's said potentially harms the patients from mercury within the amalgams placed in their teeth and toxic level mercury vapors affecting dental personnel exposed over a long period. The ADA and National Institute of Health Nations Administration have agreed that there is no basis for claims that amalgam has a significant health hazard. The risk is higher for dental personnel than the patients. Application of dental amalgam distribution. It's supplied by the manufacturer in a sealed single-use capsule with the proper ratio of alloy powder in one side of the capsule and then the mercury on the other side, and this is going to be separated by a membrane. The capsules are available with 600 milligrams of alloy for a small or single surface restoration, and then also in an 800 milligram alloy for a larger restoration. If more amalgam is required, additional capsules are triturated as needed. Trituration is the process by which mercury and alloy are mixed together to form a mass of amalgam that is needed for the restoration. There are two types of capsules require the use of an activator, which breaks the activating membrane. The amalgamator is set to operate for the length of time specified in the manufacturer's directions. The amalgam is then carried to the tooth by amalgam carrier and placed in increments into the prep tooth. Each increment is condensed immediately with the use of an amalgam condenser. The purpose of condensation is to pack the amalgam tightly into all areas of the prep cavity and aid in removing any of the excess mercury from the amalgam mix. So as we're condensing, that excess mercury is going to come to the top and then be wiped away. With the use of hand carving instruments, the dentist is able to carve back the amalgam material to the tooth's normal anatomy, which was removed during cavity preparation. We use a burnisher to smooth the amalgam. Once most of the carving has been completed, the patient then will bite down on articulating paper. We want to remember that the amalgam is still a little bit soft, so we want them to bite down lightly. And we're going to check the restoration and the occluding tooth to make sure that things are lining up. This is going to complete part 1 of this chapter.